A child reaches out to pet the family dog. The dog's tail is wagging. Everything seems fine, until the dog abruptly snaps. Millions of people are bitten by dogs every year. The overwhelming majority of the victims are children, and the bites usually come from a familiar pet, not a stray animal. Owners often claim the attack happened completely out of nowhere. But an unpredictable dog is a myth. Dogs almost never bite without warning. The illusion of the sudden bite is caused by anthropomorphism, our habit of projecting human emotions onto animals. When we assume a dog is smiling or guilty, we become entirely blind to their acute physiological distress. Preventing these tragic injuries requires unlearning our human assumptions. We have to treat canine communication as a clinical, biological language, built on specific somatic markers. The most dangerous misconception in canine body language is the wagging tail. A wagging tail is purely a somatic marker of arousal. It means the dog is stimulated. It does not automatically mean they are happy. This photo captures aggressive arousal. Notice how the tail is carried high above the spine. Those rigid, rapid movements from side to side are physiological signs of intense agitation, not joy. Contrast that with this image. A truly relaxed dog holds its tail in a neutral position, extending naturally along the curve of the spine with a loose, mid-height sweep. Facial cues are equally misunderstood. A yawning or a lip-smacking dog is rarely just tired or anticipating a meal. In a chaotic environment, these are involuntary calming signals, autonomic responses indicating acute stress and a plea to diffuse a threat. This photo shows a genuinely relaxed canine mouth. The eyes are soft, the jaw is open with minor panting, and the lip corners are soft and slightly upturned. The facial muscles are entirely free of tension. Relying solely on a wagging tail or a seemingly smiling face is a dangerous oversimplification. It ignores the mounting autonomic tension underneath the surface. You have likely seen a dog give a wide-eyed, sideways glance and assumed they looked guilty. Guilt is a human construct. That wide-eyed look is actually an early warning threat detection response. This image displays a clinical marker known as whale eye. The dog locks its head in place while its eyes dart around to track a stressor, exposing the glassy whites of the eyes, or the sclera. This is a clear indicator of high stress. There are a few breed-specific morphological exceptions to note. Brachycephalic breeds, like pugs, have shallow eye orbits that naturally expose the sclera, mimicking whale eye even when the dog is completely relaxed. When visual cues fail, oral warnings escalate. In this image, the Doberman's mouth has closed, facial muscles are tight, and the muzzle is severely wrinkled. The lips pull back in a long lip configuration, ending in an offensive pucker that bears the front teeth. These dramatic facial shifts are a desperate attempt to communicate extreme discomfort, pleading with the threat to back away before physical action becomes necessary. Before a bite occurs, a dog will often turn its head away or avoid eye contact. They aren't ignoring you or playing hard to get. They are deploying polite, active submission tactics to de-escalate the situation. These technical illustrations demonstrate those submissive states. You can clearly see the lowered body weight, the ears pulled flat against the cranium, and the completely averted gaze. If these pacifying gestures go ignored, you will see a sudden, stiff pause in movement. The dog freezes as their internal tension reaches its peak. The bottom illustration shows the result of that ignored tension. This rigid freeze, accompanied by a hard stare and raised hackles along the spine, is the absolute final boundary marker. When a dog's polite avoidance tactics run out, that silent freeze is the final alarm. Ignore it, and an explosive defensive attack becomes inevitable. This animated diagram illustrates our ultimate clinical conclusion. Accurate interpretation of canine psychophysiology requires evaluating the entire body in context. You cannot cherry-pick isolated features. You have to read the tail, eyes, mouth, and spine as one interconnected system. This biological data establishes clear safety protocols. Never approach an unfamiliar dog, and teach children to never lean over or crowd a dog's face. Respecting boundaries is non-negotiable. If a dog moves away, turns its head, or displays any autonomic calming signals, you must immediately give it space. Dogs use this elegant, nonverbal language for one specific reason: They want to avoid biting us. Understanding a dog's body language is the highest form of empathy we can offer them. By learning to speak their silent biological truth, we replace dangerous illusions with mutual trust and become the safe protectors our dogs deserve.